and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together we are the
therapist.
most famous physical therapists on the internet.
In our opinion, Bob. Of
Okay,
course.
Brad, today we're going to talk about these, when is your neck or back serious enough that you should see a doctor?
Yeah, this is a important thing to have an understanding of, because
Right.
when it's time to go in.
Right. And first thing we want to talk about, Brad, is the nature of referred pain. What we call referred pain is like, let's say you're having trouble in your neck, but it's sending pain down into your arm.
Right.
It's referring pain into your arm. So quite often, the further the pain goes down, the more serious it's getting.
Exactly.
So a common pain pattern would be, you're going to turn around, Brad.
Yeah.
You're going to start getting in your neck. Then you might get it between the shoulder blades, and that can be from your neck, by the way.
Sure,
Or it
often.
can be in the shoulder blade, and then it can start to transfer down into your arm.
Yep.
So you go, the outside of the arm, sometimes on the inside in the armpit,
Yep.
and then it goes down the arm. And when it goes all the way into the hand, or there's tingling,
Yep.
yeah.
And particularly, and this happens because that's with the nerves. This is following the nervous system. But if you start get tingling, numbness, or if you start losing strength in your grip, you for sure got to get into a doctor.
Exactly.
When you can't hold a cup of coffee, that's some symptoms. I tell people it's time to bypass therapy and let's get going.
So if we're talking about the back, on the back, Brad, you want to go
Sure.
ahead? It's going to start in the back, then often it goes down into the butt. Actually, quite often, Brad, if it's down here and nowhere else, a lot of times it's coming from the mid-back.
Sure, yep, it
Because
can
the mid-back
refer.
sends pain down into here. But if you're getting pain, it starts here and goes into the butt, back of the leg, calf, foot. Again, the further it goes, the worse it's getting.
Right.
And that's when you want to go ahead and start, thinking about seeing a doctor. So, second thing, Brad, just as a general rule of thumb, if you're under 20 or over 50 and you're having pain for the first time, they generally recommend that you go in and see a doctor.
Sure.
So, third, if it never stops and it's constant, and I mean like even at night you're feeling it, or there's just no relief.
Right.
It's just
No
all
matter
through
which way you turn.
which position. Yeah, something's not going on right,
Right.
there. I mean,
it means it may not be a mechanical thing. That may be
something inflammation or infection.
Right. Yep. I don't want to get into the chemical part of it, but
Just as a rule of thumb, and generally you're going to be seeing a doctor because you're so uncomfortable because
Right.
it just won't go away. But constant pain is not a good thing. Well, the first thing Brad and I like to see when we're treating someone is we find a position that takes away the pain.
Right.
Then we have a good chance of treating it.
right.
And a lot of times, Brad, if we can find a position that even makes it worse, that's a good sign. You know what I mean?
Right.
Because
It
that
means-
means we can make it better.
Right. You have to keep looking for the way that does make it better. Before we go much farther, Bob, I think we should mention a lot of these people have not seen our channel yet and aren't aware of what we can do for
we do
them.
a lot of videos. We upload a video every day, 7 days a week. We're the hardest working therapists on the internet, right, Brad?
Exactly.
And we have a subscribe button right over there. You're going to want to subscribe. Videos on how to stay healthy, fit, pain-free.
From head to toe.
Yep.
Now, Bob, with the pain down the leg, I think I wanted to mention something. A real common thing, not common, but can happen, is the drop foot.
Oh, yeah.
If you're walking, you got the pain down the leg, and you find that as your foot kind of slaps down,
Start slapping.
or your toe is dragging because you cannot lift your toe up. If you can't walk on your heels like this because one is too weak.
Right. I think Lonnie was just going to show that. Did we get it, Lonnie, or not? Want to show it again, Brad?
Okay. This is a very common test of
Yeah.
doctors and therapists. Can you walk like this?
And also on your toes.
Or on
yeah.
your toes. If you could do that on one foot and the other one's not strong enough, you got back pain down your leg, I'm seeing a doctor quick.
Yep, you are, because things are getting serious very quickly. If you've had cancer in the past or currently have cancer and you start having pain, you need to go into the
Yeah,
doctor.
get it checked
I mean,
out. It may be nothing, it may be not.
Exactly. We're not trying to alarm you, but you just got to, you've got to be a little extra careful if you're dealing with something like that.
Cover your bases.
If you're on a steroid medication, you also need to go ahead and see a
Sure.
doctor if you're having pain, especially steroids, because a lot of times they take away the pain. So that really makes me
They mask it, yes.
right. If you are abusing drugs and you're starting to have pain, you want to go in. This is just a general kind of public
Right.
service announcement, Brad. All right, Brad, another one is if you've lost a significant amount of weight or if you've lost weight and you're not trying,
Right.
that's not good.
Right.
I mean, there's something going on and
Exactly
you have
right.
pain with it. You need to get it checked out.
Yep.
I can't tell you how many times I've seen that in people, and sometimes it's been serious and sometimes it's not, but
Right.
you need to go in and check it out. So if you have a fever along with it, Brad, especially I think about encephalopathy or some of those things that could happen
Sure.
in the neck. You have a stiff neck and you're getting a headache or anything like that, you're definitely going to want to get it checked out.
Right. It's
So,
not going away, getting worse, the type of thing.
if you don't feel well, Brad, and you're having pain along with it, I know that seems, that people would, I know that I need to go in. No, a lot of people are like, oh, I just don't feel well. But if you don't feel well and you don't have pain, and you're having pain,
You got to take this into context. I mean, if you've been around 30, 40, 50 years, you pretty much know what the common flu
yeah,
feels
you know what
like.
your body is doing.
You know what, the common cold, those kind of things. But you're having something that just is different, and you're having these symptoms combined.
I know when we have people on therapy, Brad, and they're not getting better, what do? We send them back to the doctor, don't we?
Yeah.
I mean,
These are, we call them red flags. If a red flag
Yeah.
comes up, things aren't adding up. It's time to go in and see if there's something else wrong.
if you've had neck or back pain for more than 4 to 6 weeks, and you haven't seen anybody, it's time to go in too and see what's going on.
Right.
I mean-
And if you see, you're going to. It depends what country you're in. A lot of times, if you have direct access, you can go to see the therapist first. The therapist is going to screen, and if they're concerned, they'll send you to the doctor or go directly to the doctor.
Right. Did we talk about night pain, Brad? We mentioned it, didn't we?
I don't think we did.
Yeah, night pain is always kind of a red flag. They always talk about night sweats too.
Right. Say you got back pain, but throughout the day it's just fine. Then you go to sleep and it wakes you up at night, and then you get up the next day. Fine during the day. Let's say you have a physical job, no problem at work, no problem at home. You go to bed, it wakes you up in the middle of the night consistently. Get it checked out.
Yeah, that's always a little bit of a, like you said, red flag.
Yeah, maybe nothing.
Maybe nothing, but
it's
it's
unusual.
one of those things. Yeah, it's not typical because generally when you're laying down, there's less stress on your back and neck unless you have a really bad, mattress.
Sure.
So, all right. If you're having really severe pain, and I think most people know they're going to go in with that.
Right.
So,
Yeah.
something that you alluded to earlier, Brad, is if you're starting to get some weakness. Now you talked about drop foot. Well, in the hand, let's say you're starting to get a little weakness in your hand,
Yep.
or a weakness in the thumb, or weakness anywhere, numbness and tingling going all the way down. It's time to go in.
Right.
And when it gets that point, it's getting severe.
Right.
So,
And then the big red flag, and is if you lose control of your bowel movement.
right.
If that happens, you're going to the emergency room.
Yeah, if you're and in that instance, we're talking generally about back pain,
Yep.
bowel or bladder. The other thing with that, Brad, is if you have what we call saddle anesthesia, if you have numbness or tingling in the parts of your body where that would hit if you're sitting on a saddle.
Right.
So if I'm sitting on a horse on a saddle, all this area here, and that part, you get a sudden onset of what we call numbness or tingling, plus you lose your bowel bladder. That's an emergency.
Right.
That means you've got a blown out disc,
Right.
and you need to get in immediately to see a doctor.
Exactly.
That's not when you.
Yeah, you're not
mess
going to make
around.
an appointment for. You're going to the
Yeah.
ER.
Get on your horse. No,
Yeah.
just, get in the
shouldn't
car.
joke on that one.
Yeah, we shouldn't because that really is serious. We talked about the numbness or tingling. If things are suddenly getting very, very stiff, the back or the neck, you should also see the doctor. There's a lot of some kind of disease processes that can cause that.
Sure.
So you want to make sure that you're getting in to see that. An additional neck one, Brad, is if you are getting pain in a lot of different, like if you get pain in the front of the arm and the back of the arm, different what we call dermatomes.
Right.
That's often a kind of a weird thing.
Right.
Generally, back pain tends to run what we call down certain dermatomes. And so if you're getting the whole entire arm hurts, that's really strange.
Yeah,
And
like
that's
all
something-
the fingers. It's
Right.
not just this pinky and the half of this one or these three. It's the whole hand, the whole arm. That's like I said, this is not common with the radiculopathy we work with.
Right. If you got a fever and you're vomiting and you have pain too, again, I'm sure these are pretty common sense, but
Yep.
sometimes people maybe they need a little extra incentive to go in. Yeah, if those things are happening, you definitely
Sure.
need to go see the
Right.
doctor. All right, and if you're not, if things are going fairly decent, you got to watch some of our videos because we provide lots of help hints on how to deal with back pain and
Right.
neck pain.
And if you got through this whole video and you're
Yeah.
still here, you probably need to go in.
All right, thanks for
Take
watching.
care.